Welcome to Medicine, Motherhood, and Missions, the podcast where we dive deep into impactful and inspiring conversations with amazing professionals who've turned their challenges into stepping stones for success. I'm Johanna, your host, and each time we meet, we'll explore the stories and journeys of remarkable individuals who are PAs, doctors, professionals, mothers, and mission-driven changemakers, from the halls of the hospitals to the hearts of our homes, and into the communities we serve. Join us as we uncover the challenges, triumphs, and everything in between, and see life through each other's perspective. If you're seeking fulfillment in your career and life, I've got something special for you too. Download our free guide on how to be a fulfilled provider. It's packed with tips and insights to help you thrive while balancing the many hats you wear. And for all those parents out there dreaming big while raising little ones, check out Little Evie's Big Dreams children's book series, available now on Amazon. These heartwarming stories inspire kids to chase their own dreams, just like you're chasing yours. So grab your favorite cup of coffee or tea, settle in, and get ready for uplifting conversations that will leave you inspired and equipped to make a greater impact. Let's jump in. Hi, friends. I'm so excited to hear today from Miss Taylor Morgan Christie. She is the founder and lead practitioner of Whole Wellness, a functional medicine practice based out of Northwest Arkansas and serving patients in Arkansas, Oklahoma, and Texas. She is a board-certified physician associate and a registered dietitian nutritionist, and is also double board-certified in functional medicine through the Institute of Functional Medicine and the Integrative and Functional Nutrition Academy. Taylor discovered her passion for integrative and functional medicine after it transformed her own life, helping her heal from years of IBS, hypothyroidism, and hormonal imbalance. She has since spent over a decade studying and mastering the functional medicine approach to help her patients find whole wellness. Conventional medicine often focuses on symptom management, but Taylor's approach to medicine goes far beyond. She partners with each patient to truly uncover the root causes of diseases and provides comprehensive care that optimizes their health. So, Taylor, thank you so much for joining me on the podcast. I'm really excited to meet with you and speak with you and hear your story, because you were kind of giving me a glimpse of your story, how it kind of was a God moment and interesting how everything kind of started. So tell us a little bit about yourself and your journey so far.
Absolutely. So thank you for having me too. I'm excited and love sharing about my passion and functional medicine and my faith and everything like that. So, I'm Taylor, and I am a board certified physician assistant and dietitian. Dietetics was my first career, and then I felt called to go back and expand my scope as a PA. And we can get a little more into my journey later. I can share it now. But I about a year ago, made a big leap to open my own practice as a PA. And while that journey has been stressful at times and difficult, it's been such a sweet blessing just to have the freedom to be able to help people how I want to help people, which is my biggest passion and mission.
Yeah. So how did you want to even become a PA and the dietitian as well? So how did that interest even start?
Yeah. So to make a really long story, hopefully a little condensed, I grew up in a household growing up. My dad was actually an anesthesiologist, very health focused. My mom taught fitness classes, so very health focused family. So that was kind of, ingrained in my nature as a kiddo, just being active, eating cleaner, etc. I actually went off to the University of Georgia for college first, my freshman year, and I didn't know what I wanted to do. I just knew I was good at math and science. And so I declared I was a business major. I declared business because we had to declare. And for fun, I took a food science class my freshman year, and I just fell in love with nutrition and how we can optimize our body through food and how we can, help with disease and ailments through like a whole foods, healthy, anti-inflammatory diet. So I really hit the ground running from there. I quickly changed my path and changed to pre-med and pre-nutritional sciences. ended up going to the University of Oklahoma Health Science Center for dietetics school.
Okay.
And I was in dietetics school and, learning. Most dietetic programs are very conventional. I think at the time my pyramid just changed to my plate. So like learning just the FDA guidelines. And while that was necessary, I just remember sitting there and just really thinking to myself, like, there has to be more than this. Like, I want to learn food as medicine, and I want to learn like medicinal uses of herbs and like all these amazing things God created that we can use to help heal our bodies. So I quickly ended up finding more like Ayurvedic medicine, if you're familiar with that term, and then integrative medicine, and that led me to functional medicine. Graduated from dietetic school and was just blessed enough to have my first job in an integrative medicine facility, an integrative medical clinic in Tulsa, Oklahoma. And I really hit the ground running. I just got my hands on all the information that I could. I did multiple certifications as a dietitian in integrative medicine, and just became so passionate about what I was doing and helping clients, etc. I actually ended up starting my own practice as a dietitian. I had my own LLC and my own practice, dietary functional dietitian practice, and served clients in Oklahoma City. And then I ended up getting recruited to this very well-known functional medicine facility clinic in Austin, Texas. So back in about 2015, I really felt like it was the Lord opening a door, and I dropped everything. I left my practice that was doing good, and moved to a city where I knew no one. So was in Austin, and, it was a great experience. I was being trained by amazing practitioners that were very well versed in functional medicine.
Yeah.
And unfortunately, though, I didn't know how to manage my stress at the time, and I really burned out. I was working, full time, overtime, doing one of my board certifications at the time also. And then being in a new city, and I just didn't know how to manage my stress. So my health really suffered, and it was really a come to Jesus wake up moment for me of like, wow, I have to take care of myself to take care of others. So it was that, also with really just wanting to expand my scope of practice as a dietitian, because there's very clear lines of what can you recommend and what can you do, and, that kind of stuff. And so I really thought through and prayed through if I wanted to go to medical school or physician assistant school. And I talked to multiple practitioners on both ends, and a lot of dietitians that went back either way. And funny enough, some of the physicians, it was like a 50-50 split of like, do it. We love what we do. And others were like, I don't know. It's like, it's hard to have a work-life balance as a physician and being on call and the responsibility and, the schooling since it was a second career. And then I remember so vividly, I talked to 4 or 5 PAs, and they were like, I love my job. I love what I do. I can have healthy work-life balance. I can have time for my family. I can swap specialties. So I was kind of sold on it as a PA, and I applied to multiple PA schools and really left it to the Lord, because I was happy with my career as a dietitian. I was satisfied. But I was like, okay, God, if I get into PA school, like I will go back, and I applied to a few different schools and got in. And so I just felt like that was my next step. So then I went back to physician assistant school. And when I went back to PA school, like I went into it knowing I wanted to do functional medicine. Like I didn't go into it thinking I would change to derm or ER or whatever. I was like, this is a sacrifice I need to make for 2.5, 3 years to go back to school and to work really hard and learn what I need to learn and complete my boards, and then practice how I want to practice. So long story short, that's kind of how I got into both of those fields. And I love my job so much, I would do nothing else.
Yeah, I think that's pretty amazing. The fact that you had already started a business as a dietitian and functional practitioner, and knowing that, probably your end goal is to own a business again, start your own practice, that you decided to do and become a PA versus a physician, knowing that eventually you will probably be going back to having your own practice. So that's unique, because a lot of people think like, well, to own your own practice, do your own business, you have to have an MD, DO physician degree, right?
Mm-hmm.
So that's pretty amazing.
Yeah, and I will say,
Mm-hmm.
when I actually went back to PA school, I didn't really know that I wanted to have my own practice as a PA, to be
Okay.
honest.
Mm-hmm.
I loved having my own practice. I loved the flexibility. I loved
Mm-hmm.
being able to take off when I wanted to take off, or see more patients and get compensated for it. Like, all those things.
Uh-huh.
But I didn't think it was possible as a PA, to be
Yeah.
honest. I didn't really think about
Mm-hmm.
it. I just thought of like, oh, I'll join a practice and a business.
Uh-huh.
But yeah, it ended up, being possible, as far as, and even, with like a contractor position,
Uh-huh.
there are opportunities out there where you can set your own schedule and be
Uh-huh.
your own boss. And that was just
Right.
something I didn't really think of before going
Uh-huh.
back to PA school, although I loved having my own thing as a dietitian. So
Yeah. So how did you end up leading that journey to start the business?
yeah, so honestly, it was just all the Lord.
Uh-huh.
So I graduated physician assistant school. I moved to Northwest Arkansas. I
Uh-huh.
started in a concierge functional medicine clinic where
Uh-huh.
I learned so much. It was so great. I had an amazing supervising physician.
Mm-hmm.
But I quickly learned that the concierge practice was just really not conducive to my physical and mental well-being. This was in the height of the pandemic, and I
Oh
was
yeah.
working 12-hour days, 5 days a week, and I was on call
Yeah.
every other weekend. So,
Oh my goodness.
and I was salaried, so it's just what I had to do. And I just quickly learned, I'm like, I can't, this is not what I want to do.
Yeah.
I ended up getting recruited to a functional medicine clinic in DFW, Fort Worth
Mhm.
specifically, and started working there. And while that was a better fit, I did miss Northwest Arkansas. I don't know if you've been here, but it's a little hidden gem.
That's what I've
And
heard.
yeah, it's beautiful. It is beautiful. It's actually very
Yeah.
health and wellness focused. It's
Uh-huh.
great. There's a lot of hiking. So anyway, side note,
Yeah. Yeah.
met my now husband in DFW, and ever since we had started seriously dating, I was like, "What do you think about Arkansas?" So anyway, and it was honestly just another God thing that we ended up getting engaged, and then an opportunity opened up for him to relocate here. So we moved back to Arkansas. And
Mhm.
since moving back to Arkansas, I just really felt God calling me to like bloom where I'm planted, right? Like I
Mhm.
was doing telemedicine. I was so grateful the practice I was working at in Fort Worth was allowing me to just keep my job, but move and do totally telemedicine. And while that was great, and I was so grateful for that, it gets lonely when you're doing telemedicine all day and you're just on screens and you have no interaction, adult
Yeah.
interaction. And
Mhm.
so I just really felt like I needed to get planted locally, and I didn't know what that would look like yet.
Mhm.
A colleague and I actually started a functional medicine meetup group here in Northwest Arkansas, and
Okay.
that is all different kinds of practitioners. It's physicians, DOs, MDs, NPs, health coaches, dietitians, physical therapists, pelvic floor therapists, massage therapists, all these things. And it
Yeah.
actually grew over the last 2 years from 10 people to over 120 people. So we started that a couple years ago, and I was at a meeting one night, and I had met this wonderful woman, and who is now my supervising physician. So where I didn't think it was possible, just with
Mhm.
logistics of having a supervising, etc.,
Uh-huh.
God really put her in my life and
Mhm.
made it possible. So it was from there that I think she had even instigated of like, well, why don't you do your own thing? Because I think I
Uh-huh.
was talking to her about positions, and I was like,
Right.
well, I had met with some clinics locally. They were great, but just not, I
Mhm.
didn't feel like it was right. And I think she had prompted that. And yeah, it just honestly took from there where I just didn't think it was possible. And just God totally opened the door to allow me to do my own thing.
Yeah, that's pretty amazing how those little step-by-step journeys lead us to where we're supposed to be.
Mm-hmm.
And it's completely a journey, right? And just one thing after the other, one opportunity to chance meetings, right?
Mm-hmm.
That take
Absolutely.
us to the next stage in our journeys.
Mm-hmm.
So that's really cool. And like, so now you have your own business. Is it like virtual, or how did you even like decide what kind
Yeah.
of?
Yep. My husband and I are in Northwest Arkansas. So I do have
Uh-huh.
a physical location in Fayetteville, Arkansas that I rent office
Okay.
space from. So
Uh-huh.
I'm licensed to practice or see patients that reside in Arkansas, Oklahoma, and Texas. I'm licensed in all 3 states.
Mhm.
I can see people in person, but then I do a lot of telemedicine as well. So I
Mhm.
have a big Texas population that kind of came from my other practice and by
Okay.
word of mouth, and then some
Uh-huh.
people in Oklahoma as well. So
Well, that's
it's been
neat.
great, and it
Yeah.
gives people flexibility, and then it also
Mhm.
helps me when I do have if part in person, part virtual
Uh-huh.
is kind of the perfect blend for myself, just
Yeah.
from not being in front of a screen all day, every
Right.
day, getting some in person interaction, but also
Yeah.
having that flexibility and not being in an office, 8 to 5, Monday through Friday.
Yeah. Yeah. Definitely that freedom is
Nice.
amazing.
Oh my gosh,
And
yes.
yeah, but I wanted to like ask, like, so what is functional medicine versus like allopathic medicine, and because you were in it even before PA school. So like, how did that even come about? And your dad is an anesthesiologist in allopathic medicine, I would,
Yep.
assume. And so like,
Mm-hmm.
um, what, what was that interest in functional medicine that, and then, combining it with your PA degree. So like, how did that
Yeah.
all start, and what is it all about?
Yeah, so functional medicine it's not a
Mm-hmm.
medical specialty. It's just
Mm-hmm.
a way of practicing, basically. I
Mm-hmm.
mean, it is the Institute for Functional Medicine. If any listeners are interested, IFM, Institute for Functional Medicine, is like the big gold standard governing body that educates practitioners and has a board certification, etc. But it's not a different specialty. It's just a way to see a patient and treat a patient and help a patient. Meaning, I always kind of like to say, on one hand, yeah, you have conventional or allopathic medicine. On the other hand, you have alternative medicine. So when you think of alternative or, completely alternative, no medications, etc. And then in
Right.
the middle, you have more integrative, right? And so there's a good blend of like time and a place for prescription medication. If there's a way we can do diet, lifestyle change, maybe some supplements that kind of blends the integrative. And then
Mm-hmm.
functional medicine takes it one step further. And again, it's more the approach. So, meaning, it's evidence based. There's a time and a place for conventional treatment, absolutely, especially in acute care situations. But if we can dive deeper and kind of help with the terrain and kind of where the disease process developed in the first place, then with even natural modalities, that's kind of the way we want to go. If you might have heard, this is another term, it's like the root cause approach, basically. Okay. So, like,
Okay.
again, it's just an approach of like, I like to use hypothyroidism as an example to this
Mm-hmm.
of, you have a patient, they come to you and they are cold all the time and they're
Mm-hmm.
tired and they have dry skin and their hair is falling out. And you do
Mm-hmm.
labs and, you see hypothyroidism on the labs, you diagnose them, and conventionally, you just diagnose and then you prescribe levothyroxine or a thyroid
Right.
medication. We do
Mm-hmm.
all that in functional medicine. We do a lot of times more detailed blood work, like a full thyroid panel. But what I'm asking myself when I see this patient is like, why? Like what is affecting their thyroid or inhibiting their thyroid to properly function? And so we are working up diagnosing, treating, but we're taking it one step further and saying, what are some of those root causes that are causing this imbalance in the first place, if that makes
Mm-hmm.
sense? So that being said, where I do prescribe certain medications, I'm working on those causes and working on the terrain. And that hopefully will prevent further disease,
Uh-huh.
prevent further damage, etc. May be able to get people off of medication depending on what's going on as well, or prevent medication. So it's just an approach. It's looking for and trying to optimize those root causes
Mm-hmm.
so that people can heal and get better,
Mm-hmm.
over time. And there's not,
Yeah.
you have less disease process in the future.
Right. Okay. Yeah. Because sometimes it's confusing for patients or people. They sometimes think, there's functional medicine or just like no medicine, or like it's like all these different aspects, so it can get confusing. But so and I now have interviewed a few functional medicine practitioners, and so it's interesting that they do all say, it's getting to the root cause. Kind of the approach is what you're saying, is the approach to helping the patient, and not just symptomatically treating them, but finding out what exactly is going on underlying that they may have that's contributing to what they're facing right now.
Yep, absolutely.
Okay.
And like I said, I mean, and that's one thing that I'm really passionate about educating, because functional medicine is not alternative medicine. We are not no medicine. There's a time and a place, and medicine can be life-saving, right? And there's such a time and a place for, for medication management. But like I said, if we're able to optimize the body from some natural modalities, or dig deeper and prevent further medication that's needed, or be able to get people down off of certain medications, like, I'm all for that, obviously, too.
Yeah, for sure. Yeah. And I think, even you had mentioned like Ayurvedic kind of practices that you had learned about too. So how does do you incorporate any other kind of Ayurvedic approaches or things like that into your functional medicine practice, or anything like that? Or
Yeah, so I guess kind of similarly, and especially with my dietary background, I mean, with every patient, I'm talking about their diet. I'm talking about what they're eating, what they're putting in their mouth, and then also how they're eating, right? Are they multitasking and they're standing up and they're shoving food in their mouth? Or are they trying to sit and rest and digest and relax? So those things are both important, for sure. We're talking about like color and variety and diversity. And I tell patients, ideally, and I will say I don't do this every day, but if I could, I would, and it's my goal, is to eat every color of the rainbow every day and use a lot of spices and herbs and everything like that. So I do educate along those lines. And then, yes, I do use supplements and botanicals as well, depending on what's going on with the patient. So, I mean, those are some things I incorporate. I'm very pro team-based approach as well. So a lot of times I'm referring out like for acupuncture to help support the nervous system, or for them to do some massage and some cupping, or to see a pelvic floor therapist, or to see a counselor. So, I know I can't do everything myself, and there's so many other practitioners that can be helpful in a healing journey. So I am a lot of times referring out to have like a really whole body, whole person approach too.
Okay. Yeah. And so, what are like some other common misconceptions about functional medicine that you've come across that maybe might help others kind of see the benefit?
Yeah, absolutely. So again, like functional medicine is not alternative medicine. We are not anti-medication. We are not, I mean, I have prescriptive rights. So like I can prescribe, and some people, they see a practitioner that can't prescribe and can only do supplements. That's where I love being a PA versus an RD, because I can do a blend of both, and there's time and a place for a blend of both, right? So that's, first and foremost is like, we're not alternative. We're like a happy integrative blend. Another misconception is like, it's not evidence-based. It's not science-based. And it is evidence-based, and it is science-based. And that's the biggest thing, is like, we're learning the physiology of the human body, and we are really trying to optimize the physiology. I mean, I have some tests that I run that look at the electron transport chain and look at the organic acids from the electron transport chain in the mitochondria, and it can show us B vitamin need and energy production. So like, very nerdy science. So if you love science, like you love functional medicine, because you're really just learning basic human physiology and like how to optimize physiology, right? I'd say those are probably the biggest things. The other thing I will say is like, I'm not, and I kind of said this, I'm not anti-medication. I might get a patient, and I've seen this a couple times where, I have a really big intake form I have a patient fill out, and their goal is they tell me, I want to get off my thyroid medication. And I'll be very upfront with them at first. I will say, you know what? That's not a bad goal. That's a fine goal if you want. But I don't care if you're on thyroid hormone replacement long term or if you're not. I just care that you're optimal is what I care about, right?
Mm-hmm.
I care your levels are optimal. I care that you're feeling good because our thyroid is our master gland
Mm-hmm.
and it affects so much, right?
Yeah.
So
Yeah.
much. So that's what I tell people. So I kind of reset that stage of like, the goal is not necessarily like to not take any medication or not take anything. It's just to optimize the body. And some
Mm-hmm.
people can do that and they can get off their medication, etc. But other people, like if they have Hashimoto's disease and their thyroid gland has been severely damaged by that autoimmune attack, like that may have to be a
Mm-hmm.
longer term thing. But we can
Mm-hmm.
optimize the medication that they're on. We can choose
Mm-hmm.
cleaner medications and we can make sure they're on the right dose. So
Right.
those are kind of some of the misconceptions is,
Mm-hmm.
I like to have a very good blend and I'm thankful with my
Yeah.
degree that I can blend those really well.
Yeah. Yeah. Yeah, thanks so much. Because I think, it's important to understand what exactly it is and the differentiation, but really kind of understand what it's supposed to actually benefit.
Yep,
Um,
absolutely.
and so, how has your perspective on patient care changed? Because you were in functional medicine before as a dietitian and then as a PA, but and how has your perspective on the patient changed since practicing in this way versus maybe on your rotations or in other clinical practices?
Yeah, so I mean, I'm just really grateful that, and this is actually a difference with functional medicine is
Mm-hmm.
time. So, as an example, my new patient appointment is 90 minutes. And sometimes I go over, but it's very long. And I literally start at the very beginning, even with your mom's pregnancy. How is her pregnancy with you? All the way through birth, childhood, adulthood, up until where you're at now. So people always joke, they're like, you know me better than anyone else. And I do. But it is all important
Mm-hmm.
as far as like, was your mom stressed during her pregnancy? Were you born with cesarean section versus vaginal birth? Were you breast or bottle fed? Did you have a lot of antibiotics as a child for strep? Did you have
Mm-hmm.
mono in high school? Like all those things. Childhood
Mm-hmm.
trauma, mental
Yeah.
health. They're all important parts of people's stories that usually get them lead over time to where they're at now. So I would say the biggest thing, with patient care is like,
Mm-hmm.
I'm honored. I get that time, right?
Mm-hmm.
Whereas unfortunately, when I was on rotations, like family medicine, for instance, you get 15 minutes with patients max. I mean,
Yeah.
you were seeing so many patients a day. You don't have the time. You
Yeah.
don't have the time. And I get a lot of patients, some that are, a lot that are seeking a more natural approach,
Mm-hmm.
a lot that are frustrated with the conventional medicine system. And I always remind my patients, it is not the practitioner's fault. Like
Mm-hmm.
practitioners have, you would hope every practitioner, most
Yeah.
practitioners have a great heart. They want to
Yeah.
help their patients, but
Mm-hmm.
the system is broken. The system is
Yeah.
broken.
Mm-hmm.
How do you expect, and I couldn't do this as a practitioner, how can you see
Mm-hmm.
20, 30, 40 patients a day and do a deep dive? You
Yeah.
can't.
You
You don't have
can't.
time. You can't
Yeah.
research. And so that's where I'm really grateful that, I have my own practice. I can practice how I want, but I do get time with people. I get that
Mm-hmm.
time. And a lot of people just want to be seen and they want to be heard,
Mm-hmm.
and they're frustrated. And because it's a broken system. You sit down with your practitioner and you're trying to tell them something, and then someone bothers them in the room and they have to go into another room, and they don't feel seen or heard. And so I'm grateful that, I'm in a position where I
Yeah.
can really try to understand, try to
Mm-hmm.
understand and really try to help. So yeah, that's, I would say, kind of a big thing with patient care. And I will say, patient satisfaction in functional medicine,
Mm-hmm.
it depends on the clinic. Not all functional medicine practitioners are created equal, but tends to be very high because people do feel seen and heard, and you have more time with patients. And I have more time to educate,
Mm-hmm.
I have more time to help support them. So I do feel
Yeah.
like, patient satisfaction is high
Mm-hmm.
in regards to that, just with the model, because the model is different.
Right. Yeah. That's interesting. I mean, I actually came across a patient the other day who was saying her primary care provider left the system that they were in because that system was sending letters to, and I don't know, this is what the patient was telling me, so I don't know for sure, but the patient was saying that the doctors said that they had received letters saying that they had to change their practice to make sure that they see this certain number of patients per day in this certain 15-minute time frame.
Yeah. Mm-hmm.
And they have to meet those requirements per month. And so,
I
but
believe
that
it.
is kind of the reality of the
It is.
situation. And when you are in family practice, you learn that you're focus on the one problem today, then they can come back again for the next one. And so you're kind of just rushing in versus like in your approach, you're able to hear the whole story, hear all of their problems, or, and then kind of, take the time to address everything,
Oh yeah.
which,
I mean,
yeah,
and
it's hard to do.
all
And
connected, and that's the
yeah,
thing I'm grateful for. But I was shocked when I was on my family practice rotation. I remember, as a little PA student going into the patient room and interviewing the patient, and this patient had like 6 things that were going on. And I go back out to my preceptor to present, and he goes, they can pick one thing, otherwise they come back for an appointment. And I was like, oh, okay, and I get it. I get
yeah,
it because it's time
yeah,
and like reimbursement and just how, practices are
insurance
run
and
and
all the
insurance.
things.
I
Yeah,
get it. It's just very
yeah,
tough. And I
yeah.
don't, a lot of patients don't understand all the backside of it, but it's
Mm-hmm.
very frustrating. It's really frustrating
Yeah,
for people,
yeah,
So,
yeah.
anyways.
Because definitely the providers, you know, for the most part, all the providers have gone into medicine for the fact to try to help someone and, make a difference in the patient's lives. But medicine is not what we think it is going into it. It's a whole
You
different
have to
ball game
have
after you actually practice.
Yeah, I was
Yeah.
gonna say, I have a lot of like pre-PA students that reach out to me, and I always tell people, and I'm sure
Mm-hmm.
same with physician, et cetera. You don't go into it for the money because you work a lot, and you're always working, you're always learning, you're always educating yourself. You go into it because you love it and you're passionate about it and you want to help
Mm-hmm.
people. Because nowadays it's, you can go into business and make a lot more money than you could as a medical professional, but you
Mm-hmm.
have to have just a really big heart and feel like that's, your calling. So, but it's not
Yeah.
easy. I mean, nothing in
Yeah.
medicine is easy,
Yeah.
so.
Yeah, for sure. And it's tough because you're talking about like the so many different aspects of a person's body and health that impact their life and trying to find those root causes. Um, you know, versus in allopathic, we really are symptomatically trained, right? It's symptomatically treatment of disease processes. And so it's interesting to trying to, focus more on that root cause of what's going on in the patient. But it's a comprehensive, it has to be a comprehensive approach because, you know, nothing is going to be simple when you're trying to look into root causes, which leads me to like, how do you get to the root cause?
Mm-hmm.
Um,
Yeah.
in
So yeah, and I always actually say usually it's root causes because usually there's not
mm-hmm,
one thing that's causing all the dysfunction. It's just an accumulation of like a multitude of things over years that leads to dysfunction, right?
mm-hmm,
But I would say first and foremost approach is your basic history. Again, I get
mm-hmm,
90 minutes with people. I get to hear their story. My mind is going every single second of that appointment. And actually,
yeah,
prior to that appointment, I have very detailed intake forms I read through before I see every patient. If they upload labs, I review all of
mm-hmm,
that before I even meet the patient.
mm-hmm,
So, I would say from, basically also what we learned in PA school, from a really good history, you can pretty much figure out what's going on to some extent. Now, time and a
mm-hmm,
place for labs and imaging, et cetera, but based on history and symptoms, et cetera. So that's the first thing as far as like figuring out those causes is just
mm-hmm.
hearing the patient, learning, hearing their story.
Mm-hmm.
Second is, of course, some testing. And so in functional medicine, like I can run labs through insurance. I do, a good lab panel. We do tend to do more extended panels, so bigger panels. I always try to be cautious of finances and like coverage and stuff like that.
Mm-hmm.
But like, we'll run a full thyroid panel rather than just a TSH. So free T4, free
Mm-hmm.
T3, reverse T3, thyroid antibodies if necessary, et cetera, to get the whole picture.
Mm-hmm.
We'll run vitamin D and a full iron panel with ferritin and sometimes a transferrin. So I
Mm-hmm.
do run more detailed panels to also help look at the dysfunction. And then also we do have access to a lot of functional medicine testing. That's like a gut microbiome stool test or a nutrient panel I was talking about with the electron transport chain,
Mm-hmm.
genetic testing, so we have a lot of tools in the toolkit. And I always actually tell patients this as well. There's a time and a place for conventional medicine, and, it is more symptomatic treatment. But here in functional medicine, we just have more tools in the toolkit. We have more tools to dig deeper. We have more tools to optimize, and so we do have access to a lot of different tests and modalities, et cetera, to help kind of see what that dysfunction is and then optimize the dysfunction as well. So I would say those are probably the premise is like number one is a basic, good, really awesome history. Number two is testing. But the biggest thing is hearing the patient's story.
Mm-hmm. Yeah. And definitely not knocking allopathic medicine because there's so much, so much being done for patients, and so many really good providers out there.
Mm-hmm.
But it also, so is insurance covering a lot of these types of functional medicine practices, or how does that work, like for
So
patients?
I'm fee for service. So I don't take
Mm-hmm.
insurance for appointments. I
Mm-hmm.
do give patients a super bill. So if they do want to submit it to their insurance for reimbursement, they can do that for sure.
Mm-hmm.
Just with reimbursement, I mean, you would never be reimbursed for a 90-minute visit, or
Yeah.
reimbursed kind of the time that you take for the
Yeah.
visit. So
Mm-hmm.
most functional medicine practices are cash pay or membership.
Mm-hmm.
I've been part of some functional medicine practices that have tried to do the insurance model, and it
Mm-hmm.
ends up being they have to see high volume to make
Right.
their ends meet. So
Yeah.
unfortunately, I haven't seen it work well. Like I
Mm-hmm.
said, I do try to meet patients where they're at.
Mm-hmm.
They can submit their labs through insurance for coverage. Certain functional medicine labs, like a stool test or something that I was talking about, unfortunately,
Mm-hmm.
those are cash pay.
Mm-hmm.
Those tend to not get reimbursed by insurance, of course, but blood work tends to get reimbursed pretty good. So that's something there too. And then, of course, if there's any medications that are needed, that can go through insurance too. But so, it is hard because, it does mean that only a certain amount of people could afford functional medicine. And I think there's
Mm-hmm.
a lot of practitioners out there that are trying to figure out how to make it more feasible and reasonable and to be able to serve more people. I don't know if
Yeah.
there's like a really clear, like, this is the way kind of thing. But I know
Yeah.
a lot of people are working on it just to help reach more people and make it more affordable.
Yeah. Yeah. Because if you think about socioeconomic demographics, it's like those who could afford those services, they may already have access to better resources for better health in general, and may already be in a better state of health to start with sometimes, but depends. But, then sometimes those who aren't able to access those resources, um, have more difficulties with their health, and, chronic illnesses, chronic diseases. And, it's something that I feel like, in the future, hopefully we can find a way to, have these resources more available for more of the population.
Yeah,
Uh,
absolutely.
yeah. Um, and so how do you help patients change those mindsets and habits? What have you
Yeah.
found helpful?
So, I just always, I do, after I meet with patients, I give them a very detailed plan, probably almost too detailed, of here's what I recommend: diet, supplements, lifestyle, medications if necessary, that kind of thing. And, I just try to support them, and I, try to provide support and understanding and accountability. Now, I will say, from a change, like a habit standpoint, that's where working with a dietitian, a health coach that can even see the patient more often is huge. I have a health coach that I partner with. And she does more of a membership. And so, like, she's able to check in with the patient every week, where I just don't have the capacity for that. So that's really helpful. Everyone is so different. Some people, you give them the plan, they're off running, they are great, they don't need any accountability. And other people really struggle with accountability. I mean, community and relationships are so important, and it's amazing. I work with a lot of couples, like women and men, and I love it because they're on the same page, and it makes it easier. It's very difficult to make change if you're trying to do one thing and your spouse is trying to do another thing, or your kids are doing another thing. So a family change is really, really important to make it realistic. And then, make it realistic. I mean, I always tell people, like, say there's a dietary recommendation, I'm saying, okay, let's like do an elimination diet and do 6 weeks of gluten-free, dairy-free. I will recommend that, but I always try to ask people, like, how do you feel about that? Is that realistic for you? If not, let's find a happy medium. Maybe we start by doing one first. Maybe we start by limiting. Because if I could give all the recommendations every day, and if it's not realistic, they're not going to get implemented, So I do try to make it realistic, and I try to understand where the patient is and where they're coming from, and how's their readiness for change, and what is the season that they're in. Like, we just got out of the holiday season, and I would say, I always give people a lot of grace over the holidays. Because it's like, I don't expect you to do elimination diet over Thanksgiving and Christmas. It's totally unrealistic. So anyway, those are my things. Make it realistic. Talk to your patient, understand them, hear them out, work with a health coach or someone that can meet with them more often as well. And some practitioners do have membership models. I don't do that, that they do provide a little more of that accountability, because it's more of a membership.
Yeah. So how would you encourage those who are trying to start these new ventures and businesses? Because I know it's not easy. So what has helped you, and how would you encourage others and advice in that?
Yeah. So, I'd say for myself, it's just really like my faith and totally surrendering it to the Lord every day. And just honestly saying, okay, God, this is your practice, not mine, and take it and make it and shape it how you want, and, use me in this capacity. So that's the number one thing for me, is obviously my faith, and just surrendering it, and just realizing, like, this practice is not about myself. This is about helping others and, giving God the glory. Second, I would say, like, baby steps, don't get overwhelmed. To me, I am a very type A person. And if I think of everything that needs to get done, it is very easy for me to get overwhelmed and stressed out. So literally, I have a list, and I'm like, today, these are the top things I have to do, Same with the startup, because it does take a lot of time, getting your LLC and your PLLC, and then your licensure and your malpractice insurance, and like all the things. It's a lot. And so, for me, what's been helpful is listing it out one thing at a time, getting what needs to get done, putting off what can be put off. And just like I said, taking every day, a day at a time, and not getting overwhelmed by the big picture. Before starting this, I will say I was looking back into some prayer journals that I wrote, and I was really nervous. I was like, what if I don't have any patients? What if, like, this puts us in a bad financial position? Like, all these fears. And it was very therapeutic for me to write all that down and just, like, lay that out before God. And looking back, like, God has just totally blessed the practice, like, booked me out really fast. And, that was beyond anything I could have ever imagined. I thought, oh, this is going to be a slow build. Like, I'm going to have to do a lot of marketing. And everyone's story is different. But where I get at with that is, like, don't let those fears like intimidate you, just
Yeah.
lay them out, lay them down and acknowledge those fears. But don't get too caught up in that anxiety, because those things we worry about may never happen. And then we've just spent days, hours, months worrying about things that honestly, I could have used time better elsewhere than worrying, so that's
Right.
kind of the
Yeah.
biggest thing there. But yeah, I just try to take every day, day by day, and just do the best I can, and one step at a time.
Yeah. Yeah. That's amazing. Because also, I mean, you also have like a physical location too. So it's not just a virtual business. It's also managing that physical location, staffing, or whatever else you need to do for that. But like, how is that even that process? Just like starting like that location
So
too.
I actually only rent office space.
Okay.
I don't manage
Okay.
anything with the physical location. I
Okay.
was so grateful enough. There's an awesome wellness center in Fayetteville that I just rent office space from.
Oh, that works out. That's
I
nice.
will say for the last year, I've been wearing all the hats and doing everything myself. So I've been admin, PA, nurse, all the things
Yeah. Yeah.
myself. But I'm actually about to hire a nurse, which I'm super excited about, to help out. So yeah, as
Yeah.
far as management, I would say that's not my forte. I don't really love having hard conversations or anything like that. But I am really
Yeah.
excited to have some help. And then I will say, my husband's the business guy. So I'm so grateful for him. I wouldn't be able to do any of this without him. And he's
Uh-huh.
really helped from a business standpoint of what I need to do, and how I built the practice, and just some of the
Yeah.
stuff we don't learn in school, like accounting and stuff like that. you
Yeah.
know so I'm grateful for that. And then I've had to outsource some stuff like accounting and everything too.
Right.
So
Of course. Yeah. We can't be our own everything.
no.
Especially when it comes to those things. But I also think what you had said earlier is like those community relationships, because you had built up those community relationships beforehand,
Mm-hmm.
which is how you even led to the supervising doctor and probably this renting out the wellness center is those community relationships that you had already kind of built up, which is important in continuing in this successful business, right?
Oh, yeah. I mean, I would say the biggest, probably one of the best ways that my business has grown has been word of mouth and referral. I will say I love meeting with people, connecting with people, getting to know people,
Mm-hmm.
having a team-based approach, et cetera. So I will say that was one of the best things I did very early on is, I
Mm-hmm.
reached out to other practitioners in the area, or like I said, even pelvic floor therapists and
Mm-hmm.
dietitians and health coaches, and just got to know people and got to know what they did, as far as for me to have resources for my patients, and for
Uh-huh.
them to, if they feel
Mm-hmm.
like a patient was a good fit for me, then to refer them over too. So that was one of the best things
Yeah.
that I did, is just, don't be fearful of just like reaching
Mm-hmm.
out and getting to know people and learning more about them and what they do. And, then word of mouth is the best marketing, I feel like.
That's awesome. Yeah. And how would you encourage those to have a healthier lifestyle, and leave us with a few words of encouragement?
Yeah. So I always say the root of the root of the root is usually the stress response, which is
Yeah.
so much harder to help.
Mm-hmm.
It's very easy to say lower your stress, but it's very hard to do it, because we
Yeah.
live in a fallen world, and we live in
Mm-hmm.
a world where we are given this facade of do more, be more, make
Mm-hmm.
more, have more all the time.
Mm-hmm.
And when you really look at happiness and joy, it's not about what we have or who we are, or, how many Instagram followers we have or what we do.
Mm-hmm.
It's doing what you're passionate about and what you feel like is God's calling for your life, and having community and loved ones. So I would
Yeah.
say the number one thing that I talk to every single patient about is stress and stress management,
Mm-hmm.
and that's going to look very different from person to
Mm-hmm.
person. For me, it is having margin. It's not
Mm-hmm.
overbooking my day. It's
Mm-hmm.
having time with God. It's not feeling like I'm just rushing from one thing to the next.
Mm-hmm.
For other people, it's counseling or deep belly breathing or meditation, or gratitude journaling. I mean, there's so many great resources to help manage, because we're never going to live in a world without stress. There's always going to be stress, but we need to learn how to cope with it in a healthy way.
Yeah.
So that's like the number one thing I would say is just like, figure out how to have healthy stress management, how to support your nervous system, slow down, pause, don't just be in fight flight going all day long. Right. I'd say the other things are just really basic. I always talk to every patient about just foundational health habits. And these kind of sound silly, and they're not like fancy. It's not like a fancy test and a whole supplement protocol. It's literally like, how are you sleeping and how much are you sleeping? How is your stress and how's your stress management? Are you moving your body? Do you have good purpose? Do you have good community around you? Are you getting sunshine, full spectrum light, getting some vitamin D? And then how are you eating and what are you eating? And, are you drinking enough water? So really basic stuff is my biggest encouragement. It doesn't sound fancy sometimes, but like the little things in those foundational health habits really do matter. And no supplement, pill, anything like that will compensate completely for not having some of those really just foundational health habits.
Yeah, that's really important. And so thank you so much, Taylor, for spending time discussing functional medicine, what it's about, business, how you started it, and what's encouraged you along the way. I really appreciate it. And thank you so much for your time.
Yeah, thank you. It was so fun.
Yeah, and so we'll have to try and do it again. And I hope that you all can spark hope in your own health and wellness, trying to find those ways to find hope, to manage stress better, which I think is the key of it all, as Taylor said. So thank you so much. I hope that you enjoyed listening, and we'll see you next week. Thank you so much. Thank you for joining us on this episode of Medicine, Motherhood, Missions. We hope you found inspiration, insight, and a sense of connection in the stories we shared today. If you've enjoyed today's episode, be sure to subscribe and leave us a review. Your feedback helps us reach more listeners like you. Follow us on Instagram for updates, free downloads, and to join a community of like-minded individuals passionate about making a difference through medicine, motherhood, and mission work. Remember, you're not alone in this journey. Until next time, keep sparking hope, keep healing, keep nurturing, and keep making a difference. This is Johanna signing off from Medicine, Motherhood, Missions. The medical opinions expressed on this podcast are for the informational purposes only and should not be considered as medical advice. Always consult a licensed healthcare provider for personal medical questions or concerns. The views expressed by guests are their own and do not necessarily reflect those of the podcast host.